Hello and welcome. Today we're going to be talking about the open enrollment period for Commonwealth for planned election year of 2022. So let's get started. Some important information to note is that the enrollment will be open from Monday, November 1st through Friday, November 26th. All enrollments will be completed within your employee access and Dayforce, and this 4-week period of enrollment will be open to all associates who are full-time and are eligible for benefits in 2022. This year we'll be having a passive enrollment. What is a passive enrollment? Basically, that means you must enroll or decline your benefits by Friday, November 26, 2021. If no changes are made to your current elections, then your current benefits will automatically roll over into 2022. If you enroll or change a benefit election, the effective date of coverage will be January 1st, 2022. If you decline a benefit election, the termination date of coverage will be December 31st, 2021. If you are currently enrolled in the flex spending accounts, the FSA for health or dependent care, you must re-enroll in those options for 2022. They do not carry over, and you must choose an annual amount each year. So first we'll talk about our medical benefits, which are offered through Blue Cross and Blue Shield via Anthem. Listed here are the biweekly rates. As you can see, there is no premium increase for 2022, and that's thanks to all of our lovely associates out there who have helped keep our coverage and our premium costs low for the next plan year. We've done a really great job, and we hope you keep up the great work for next year as well. So as you can see here, the biweekly rates listed for the bronze plan for single is $37 per pay. For the family options, it's $73 per pay. For the standard plan, for the single option, it's $44.50 per pay. For the family options, it's $89 per pay. The premium plan, it's $85 per pay for single and $151 per pay for the family options. If you'd like more info on what the actual plans entail, you can print them via reference attachments in your enrollment in Dayforce, or you can ask your GM for more info as well. Did you know that 75% of those insured never meet their annual deductible? So how can we stop throwing away our money? Save money on medicines. Ask for generic medicines. They have the same active ingredient but less cost-wise than brand name drugs. Ask your provider if there's a less expensive medicine that treats the same condition. Use your benefits. Make sure you're getting routine health screenings, and we'll talk about that in just a second. These tests can catch health problems early when they may be or more easily treated, and you often do not have to pay a copay for health screenings, vaccines, and annual well visits. Make sure that you're getting prenatal care if you're pregnant. This is the best way to ensure you and your baby will be healthy. Plan ahead for urgent and emergency care. When an illness or injury occurs, you need to decide how serious it is and how soon to get medical care. This will help you choose whether to call your provider, go to an urgent care clinic, or get emergency care. And last but not least, choose a plan that is right for you. When choosing a plan for 2022, think about your health needs for you and your family. If you pick a plan with higher premiums, more of your health costs will be covered. This may be a good idea if you have a health problem such as diabetes and need regular care. Use your benefits for wellness exams and why they are important. The wellness exam, aka the physical, is a wellness examination that helps your doctor determine the general status of your health. How often do you need one? If you're between the ages of 18 and 39, every 1 to 2 years. If between the ages 40 and 64, again every 1 to 2 years. However, if you're over the age of 65, they recommend one every year. If something's bothering you, let your provider know if you have any questions about your general health. Have a long list of problems? You should schedule a separate appointment to cover all your concerns. Why schedule a separate appointment? A good wellness exam will take the entire visit. A major medical concern such as chest pain deserves its own separate visit to do a good job. If you have an ongoing medical issues like diabetes or high blood pressure, they are ideally addressed in a separate visit. Use your benefits of wellness exams and what will be checked. During the examination, your height, weight, and BMI and blood pressure will be checked by the doctor. Your provider will also perform an age-appropriate physical examination on you. Women may need a breast exam, pap smear, or pelvic exam, and men may need a prostate exam, testicular exam, or hernia check. Other tests done: They might give you routine immunizations such as flu, shingles, and now even possibly the COVID vaccine as well. They will check healthy lifestyle. They'll talk about diet, exercise, and other factors for maintaining a healthy life. Your provider will determine if you should have blood work performed. Blood work may include cholesterol and blood sugar testing. Your family and social history, such as smoking status, alcohol intake, and marital status, should be updated. Again, going to your wellness exams helps keeps our costs down each year, and it is overall beneficial for your health as well. Next, some reasons to skip the ER. When it's not an emergency, get quick care with these options. So step one would be call your primary doctor or the 24/7 nurse line. Ask them questions about which care you should go to and go from there. Step two, if it's not an emergency, choose one of these options to save you time and money. Retail health clinics, like the Little Clinic at Kroger's or other pharmacies and retail stores. Walk-in doctor offices. No appointment is needed for routine care and common illnesses. Urgent care centers for conditions right away, such as stitches, lab tests, or x-rays. Live Health Online is a video visit within minutes with a board-certified doctor 24/7 on your smartphone, tablet, or computer with a webcam. No appointment is needed. Just go to livehealthonline.com or download the free app and register. These options are more convenient than the ER. They are often open at night and on weekends, so you don't have to wait to be treated. But when to head to the ER? If it is really a true emergency, call 911 or go to the nearest ER. Remember, if you go to the ER when it's not an emergency, you could be responsible for full cost of treatment. 24/7 nurse line is another option that was mentioned. Get round the clock peace of mind. 24/7 nurse line has you covered anytime, anywhere. So basically, you would just call this number listed there at the bottom, and you can get help for things like finding a provider, a specialist in your area. They can give you referrals to Live Health Online. They can enroll you or your dependents in valuable health management programs for certain health conditions, remind you about scheduling important screenings and exams, and provide guidance during natural catastrophes and health outbreaks, offer links to health-related educational videos or audio topics, and again, they can connect you to other health and wellness programs. Again, add 800-700-914 to your contacts today for the 24/7 nurse line. The other option is Live Health Online, to see a doctor on your phone, tablet, or computer 24/7. Using Live Health Online, you can have a private video chat from your home or on the go. You just need to log into livehealthonline.com or visit the app, and you'll see a board-certified doctor in a few minutes. You can get things looked at, such as pink eye, a cold, the flu, a fever, allergies, a sinus infection, and more. The doctor can assess your condition, provide a treatment plan, and even send a prescription to your pharmacy if it's needed. What will it cost? Anthem plan includes benefits for your video visits using Live Health Online, so you just pay your share of the cost, usually $59 or less. Anthem also has an app for general login and questions about claims and other concerns and finding your ID cards. That app is Sydney. You just go to the local app store to download that. Within the new app, you can again view your insurance cards, see member services, look at your claims and other benefits info, and also help you find a doctor as needed. Your user credentials are the same as it were for the existing Anthem app, or if you log in online to anthem.com. Did you know that Anthem also offers different discounts? As you can see here, there's different ones for vision and hearing. So getting digital hearing instruments, hearing exams, hearing aids, and hearing screenings or LASIK surgery, glasses, or contact discounts as well. Also, there's fitness and health benefits as well for Active and Fit Direct, Jenny Craig, Self Help Works, and Global Fit. So if that's something that interests you, definitely reach out to member services via the number on the back of your card to find out some other perks and discounts that Anthem might offer that you're not aware of. Next, we'll move on to dental and vision. Delta Dental is our dental carrier still for 2022. There was a 6% increase in our premiums for 2022. However, the last increase we had was in 2015. So we've gone almost 7 years without any increases, and that's a really great benefit to have for us. So as you can see here, the increases in the dental plans are listed via the biweekly rates. For the dental bronze plan for single, it's $44.80 per pay. With employee spouse is $9.62 per pay. Employee plus children is $9.20 per pay. Family plan is $15.12 per pay. The dental standard option for single is $10.63 per pay. Employee plus spouse is $21.30 per pay. Employee plus children is $20.37 per pay. For family, it's $33.50 per pay. For the premium plan option for single, it's $12.95 per pay. Employee plus spouse is $25.94 per pay. Employee plus children is $24.80 per pay. The family option is $40.78 per pay. The annual deductibles have stayed the same. It's $50 for single and $150 for family. I will also mention here that you must be on the plan for 12 months to have any major dental work covered, so keep that in mind when enrolling. You can change plan levels each year, but you do have to be on the plan for 12 months. The other option is United Healthcare, who is our vision carrier. There was no increases in any of their premiums for 2022. The biweekly rates are listed as the same, so for single it's $3.04 per pay. Employee plus spouse is $5.77 per pay. Employee plus children is $6.05 per pay. And for family it's $9.30 per pay. With that, there's allowable for frames to $130 and $150 for contacts within that plan. Just note that you must use those one at a time, and there have to be a year in between each one of those as well. And the plan helps also cover for your copays for when you go to visit. Again, if you'd like more info on these plans and what they entail, make sure you visit the reference attachments while you're in enrollment in Dayforce, or ask your GM for more info. Lincoln Financial Benefits also provides some great supplemental benefits if you'd like to enroll in those or like to make changes to those. For 2022, there was no increase in our premiums. The only thing would be is if you're meeting a new age bracket, that would increase your cost per year. So we have two different short-term disability policies. The first one is the standard option. It's a 14-day waiting period. 50% of weekly income is covered, and a maximum 10-week period is paid for medical leave. The other option is the buy-up option. There's an 8-day waiting period, or 60% of weekly income is paid. A maximum 11-week period paid for medical portion of your leave. With both of those policies, you must have a policy for 6 months before they'll let you submit a claim. The other option is long-term disability. There's a 90-day waiting period after the short-term portion. And there's 60% of monthly income is paid out, and a maximum benefits for up to 2 years as well. If you wish to increase the amount of your STD, LTD, term life, or spouse life policies, or if you have previously waived these benefits and now wish to enroll in 2022, you'll be required to fill out an EOI form and submit it to Lincoln. The way to submit that now is via a portal that they've established. When you go to the reference attachments portion in your enrollment in Dayforce, you will see that. You'll print the form or click on the form and you'll see the link. To visit that portal, you'll log in using the steps that they provide, and you'll complete the evidence of insurability form at that time. It'll automatically let you know if you've been approved or denied, and then that will relay that to me as well. Please make sure that you're submitting the EOI form by February so that they can approve the changes for 2022. The other options are the basic life and AD&D policy. This is already offered to all full-time associates at no cost, so it's automatically there when you go to complete your enrollment. All you have to do is pick a beneficiary for the year. Hourly employees policy is $10,000 for both life and AD&D. The line level manager policy is 1 times your annual salary for both life and AD&D. The executive level manager policy is 2 times their annual salary for both policies, maximum of $300,000 for both life and AD&D. The policy is not portable, so you cannot take it with you if you were to leave Commonwealth. The other option is voluntary term life insurance. If this is something that interests you, coverage is available in $10,000 increments for up to 5 times annual salary, rounded to the next higher $10,000. Maximum coverage is $300,000, and the guaranteed amount is $150,000. So if you elect more than 150,000, you will be asked to complete that EOI form. Make sure you're doing so again through Dayforce, clicking on the form and clicking on the portal link that is listed in there. Portability after 12 months. So after 12 months with Commonwealth, you're able to take this policy with you if you choose. There is spouse coverage that is available in $5,000 increments up to 2.5 times the annual salary, mounted to the next higher 5,000. Dependent care coverage is only available if the associate is insured for voluntary coverage, and there's a $5,000 or $10,000 policy. You must also have coverage for yourself before you can have a policy for your spouse. The other options for 2022 are the flex spending accounts or the 125 cafeteria plan options. Both the healthcare and dependent care are tax-free. So what does that mean? It must be tax-free. If you want to take home $1, you actually have to earn $1.30 because you have to pay federal, state, local, and Social Security income taxes before you take home money. So in order to take home $1, to spend $1, you have to use a flex spending account. There are rules. A flex account enables you to pay for certain expenses tax-free, but you have to plan ahead because you can only enroll once a year, and again, you have to enroll in every year. Your election, with few exceptions, cannot be changed during the year. Any money left in your account at the end of the year cannot be returned to you, and you can only roll over a maximum of $500 into the plan next year if you have the healthcare FSA. So how can you know in advance how much money to put in your flex account? Within the healthcare flex spending account, you would want to look for things that are repetitive or predictable and that you will know you will be buying anyway for that year. Some repetitive type expenses, costs that you have all the time, would be prescription copays, doctor office visit copays, contact lenses or glasses, annual dental cleanings or exams, in orthodontics or braces, because that is not covered on our dental plans, and also predictable type expenses for different things like medical surgery, dental fillings and crowns, or vision eye exam and glasses, where you can decide when you want to do it within that year. With the flex spending account for healthcare, you will receive a debit card. If you have one already, it is good for 3 years, and the money will just continue on that account. You can use that just like you would any other debit card for those expenses. However, they will track and monitor what you're spending it on. You can also submit a receipt, and it will be reimbursed if you choose to via their website and their program through there. With the flex spending account for 2022, the annual maximum amount would be $2,750. That is your highest that you can elect for that coverage. The dependent care flex spending account or work-related child care can be used by the associate to keep the kids tax-free, and the sitter or at daycare while they're at work. It shouldn't be too hard to guesstimate the annual amount paid to them. Dependent care expenses must be incurred to allow an employee and spouse to look for work, and be gainfully employed. Work can be full-time or part-time, and expenses not considered to be work-related merely because the individual incurred it while he or she was working or looking for work. The purpose of the expense must be enable the individual to work. In other words, there must be a causal connection between the job and the need for dependent care. This one is by reimbursement only, so you must submit receipts to get that paid back to you via their portal and their website. The maximum contribution for 2022 has stayed the same, and the dependent care for single was $2,600 per year, and the $5,000 if they're married, filing jointly for the year. Again, you must re-enroll in these options each year if you choose to do so. Frequently asked questions that I get asked during open enrollment or at different times of the year. If I've lost my card, where do I go to get a new one? First, try to visit the website of the card that you need. So if you're looking for medical, it would be the anthem.com website. For dental, it's deltadental.com, and the vision is myuhcvision.com. On almost all of those, you will need to create a login if you haven't done so already, or contact their customer service department as well. If you're still not able to obtain a card, make sure you reach out to the general manager, and then they can reach out to me, and I'd be happy to assist. Where do I go to complete my enrollment? Again, the enrollments are done through Dayforce under your employee login. So make sure you choose your employee role if you have more than one role. listed when you log in. Go to the benefits overview tab and then enrollments, and it'll say click start on enrollment. So for this year, it'll all say open enrollment 2022. It's due in so many days. And again, you'll click start enrollment. How do I see my current elections? So one option is to look via your pay stub to see what you're paying per pay. The other option is to go within Dayforce in your employee login, go to the benefits tab, and then click on the current elections section. Within that, you'll see what your current elections are, and you can decide at that point if you need to make changes or keep your elections the same for 2022. Do I need to re-enroll my flex spending accounts? Yes, you will need to re-enroll every year for your health and dependent care FSA. I know I've said that quite a few times, but I always like to remind everyone of that multiple times because that is something that some miss, and we want to make sure if you want to keep that plan that you do enroll in it. Again, only $500 will carry over for your health FSA from prior year to the new year. How can I see what the insurance covers from each plan? Again, when you're enrolling under each option, there is a reference attachments link. Click on that and it will show you the summary of benefits for each plan based on the option you're looking at. So it'll have a detailed summary of benefits and answer hopefully some of the questions you might have or be looking for. Do I have to complete enrollment for 2022 or will my options carry over? It is a passive enrollment, so you don't have to re-elect if you're looking to keep all options the same. The only option, again, you have to re-enroll in yearly is FSA accounts. All other elections will automatically carry over, and all new amounts will be adjusted based on that plan level. If you want to change plan levels, increase your term life, or change your STD policy, enroll other options for the first time, now is the time to do it. Open the enrollment is the only time you can make changes throughout the year unless there's a life event, which we would need document proof of that life event change. Will I receive new ID cards if previously enrolled? For medical, yes, everyone enrolled should receive a new card for 2022 typically. They might not send those out this year unless you actually made a plan change. I haven't heard otherwise. For Delta Dental, if you change your option only in 2022, you will receive a card. For your vision, no one will receive a card at any point as they don't send out ID cards. So you can access that via their website at myuhcvision.com if a card is needed. If you have any further questions or I didn't give out any answers to certain things you might have questions about, please reach out to me directly at the 859-392-2268 number or get with your GM and they can ask me for the answer as well. I thank you for joining us in our discussion of the 2022 open enrollment, and thank you and have a great day.